Okay. So as a result of the recording not working yesterday for whatever reason, I'm just going to go through the exam 2 to give you some ideas of what you need to be studying. You've already received the cheat sheet, so you can use the study guide that I've given to you via the announcements, but here we go. A lot of it is to do with delegation, okay? You are going to be looking at, for instance, what can you delegate to who? Meaning an LPN, an RN, or an unlicensed assisted person. So, for instance, admission assessment, that's an RN function, okay? Looking at the Nurse Practice Act, making sure that for your state, that whatever you delegate to an LPN is appropriate for that particular state, because it varies, it definitely varies, okay? If a patient is stable, looking at what you can delegate, for instance, for the LPN to do. You know, if somebody, for instance, needs an enema, that's a very stable procedure. In comparison with somebody who's hypotensive, short of breath, you know, what can you delegate there? Or can you, in fact? You know, and who would you delegate it to? Know the 5 rights of delegation. And my suggestion is understand what the Board of Nursing does regarding helping the nurse to know what and who can be delegated, you know, meaning an RN rather an LPN or an unlicensed. You know, the Board of Nursing can help with those roles. Again, making sure if you delegate that the reporting is done. For instance, if you're delegating a blood pressure, making sure that the results are given to you and that the unlicensed personnel knows that he or she is responsible for that. Okay. Okay. Foley catheters. Unlicensed personnel could potentially get a urine sample from the Foley. That is something that could be done. Let's see. Okay, yes. So making sure, for instance, an RN can only initiate care plans. That doesn't go in the scope of practice of an LPN, by the way. And making sure you're not violating the 5 rights of delegation in any way, okay? Because inappropriate delegation would be doing that. Know about, again, the Nurse Practice Act, the laws and regulations, so that you know what the parameters are. That's something that the RN should be knowledgeable about. Let's see, what else? Sometimes you might need to contact the State Board of Nursing if you're unsure of what the legal scope of practice is for LPNs. Okay, again, it's very dependent upon that state. Know what is high-risk delegation, and again, the 5 rights. Understanding about supervisory levels. So what would be, how would you supervise someone and what's the expectation? Meaning, are you going to check back on them? Are you going to make sure they do the task correctly? those types of things. Again, the State Practice Acts, making sure you understand common policies. Let's see. Making sure if you're not sure about somebody, you may need to observe them first. Additional teaching, making sure that, of course, that's an RN function, but making sure that you understand what you can do and what you can't do regarding the RN delegation and what the need would be for additional teaching. Yeah, that's an unusual one. Politics. Making sure that you understand if you want to help get a bill passed, what would be the greatest impact and what would be the least impact. Making sure you understand terminology like, constituent, how you would go about getting certain information, what organizations could be helpful for you, how you would meet the candidate, what would be the appropriate types of things to do with meeting a candidate at a town hall meeting. Political action committees, what are they for? Understanding the nursing process and with policy, what step would that be in the nursing process? Understand the difference between Medicaid and Medicare. Okay. Understanding what level different states have, meaning we have different levels of government. So different health policies are at certain levels of government. So, knowing what the health policy is at, okay, understanding that, whether it's state or federal, those types of things. Again, delegation for the UAP, looking as well, I think I mentioned this yesterday, but Chekhov sign, what is that? Understanding what lab value that is relevant to. Diabetes, hemoglobin A1C, what is that? DKA, what could you delegate or not? Okay. SARS, infection control, what type of patient, where are you going to put that patient related to infection control? What type of room are you going to put that patient in? VRE, infection control, or any type of staff really. What could you delegate related to that? Could you maybe delegate collecting cultures, possibly? Seizures, what could you delegate there? And then stroke, if somebody needs feeding, how are you going to teach? What are you going to teach to the UAP regarding checking that patient? Heart healthy diet. How are you going to teach? What are you going to teach there? Mentoring, understanding what mentoring is, and understanding what type of patient would be a good patient to give to a new grad. As I say, we have a lot of things related to delegation. Most of this is delegation. So again, you're not going to do anything to do with supervising, anything to do with assessment or care plans or consulting. Nothing like that can be delegated. C. diff. Know that about C. diff. What type of med would be given. Nursing theory. I think I've given you a list of nurses that are theorists: Martha Rogers, Dorothea Oram, Hildegard Peplow, Madeleine Leninger, and of course Nightingale. So I want you just to know a little bit about their theories, just the basics, okay, so you can answer the questions. Let's see, what else? Know what philosophy means, the definition of philosophy. Okay. Know what institutional review boards are for. Okay. Know the difference between qualitative and quantitative. And then, as I say, I have put a lot to do with communication. So understanding time commitments and the certain, for want of a better word, the ideas behind time commitments, like the ABC plan or the cost to benefit ratio, things like that. Again, more understanding about how to prioritize and how potentially you would put something off because you're not comfortable with it. What would that be? What type of potential prioritizing would that be? You might want to think about procrastination. Understanding how to manage your time and making sure you have, let's think, reflection. How do you, what would be a term for that? Okay. What would be a term for that type of energy? Again, time management skills, different approaches. One of them is called the ABC prioritization. So know that. Distractors. Understand the different distractors and what they mean. Okay. Know what distractors are. Let's see, a couple of other things. Reality shock. I want you to know the different stages of reality shock. Burnout, what does that mean? Let's see some of the others. I'm trying to help you out here. Making sure that the nurse knows, the new nurse, for instance, understands certain skills. What type of skills would the novice nurse might not have, but the experienced nurse does have? Okay, what are they proficient in that the novice is not proficient in? Again, understanding about mentoring, what that means. Observing in order to learn. Empathy, understand that, or compassion fatigue. Workplace violence, Understand workplace violence. Understand negative communication, verbal and non-verbal, and different communication styles. Know the most important, or rather, the most common communication style. What is communication? Know the definition. Understand communication, the communication process. Okay, so understand certain terms and key terms related to communication associated process. Okay. Okay, I told you I had a lot on communication. Understand communication styles related to past experiences. Logical fallacy. What is that? There's a lot of different terms related to logical fallacy. I want you to know the different terms. Okay? So that you know that. Logical fallacy. What different types are there? Conflict resolution styles. Know the differences. Okay? Know the different types of conflict resolution, such as compromise is one, avoidance is another, accommodation. These are all conflict resolution. And a couple more to just go over with you. Red herring. It's part of that logical fallacy piece, but red herring, know what that is? Active listening. Understand what active listening is. There's different forms of active listening, okay? And also, what does empathy mean? Open-ended questions as opposed to closed questions. Both are useful depending on what's going on. You know, sometimes you need short and sweet in order to be effective as well. So understand the differences both with verbal and also with email. Online communication etiquette. What is appropriate? Okay. And let's see, a couple of others for you. Know the HIPAA violations. Remember what HIPAA violations can be related to social media. Understand things like supportive communication. Again, communication styles. You got to know those. There's a lot of questions on this. A lot of questions. No generational. Is there differences in communication style? So know the different generations and the style of communication. Remember what I said about research? Know qualitative versus quantitative. Know the terms. And know the description of ethics. What does that mean? What's the definition? And the different principles that could violate the code of ethics, autonomy, veracity, those types of things, okay? Know those different terms, the different principles. And then, as I said yesterday, you have about 9 or 10 dosage calc questions, mils per hour, microgram per minute, milligram per kilogram per minute type of questions, microgram per kilogram per hour as well. Okay? And that is it. So hopefully I can stop recording.